Typically, according to the size of the tumor in the adrenal gland, a lot of times it's a robotic surgery. So it doesn't require like open adrenalectomy, but some cases might need open adrenalectomy, especially if the suspicion for cancer is high and the mass is big. Typically, when we remove one adrenal gland, the other adrenal gland takes over unless there is high cortisol production. So basically, the other adrenal gland will be sleeping, will be suppressed for some time. However, patients typically feel well as long as they are taking the appropriate medicine, like as long as they are taking hydrocortisone, if they need hydrocortisone, or maybe taking fludrocortisone. So, as long as they are consistent with these medications with the correct doses suitable for their body, then I have patients who are living completely normal. They just have to be live with understanding that if I am needing the hydrocortisone, I cannot forget it. I cannot wait several weeks being out and request a refill. Like I have to have it in advance because the adrenal gland helps us with the stress response or our survival kit. So if it's not working, then we have to supplement with extra hydrocortisone from outside. So we give them all of these precautions. And I think as long as patients are aware of these precautions, they live well. We advise them usually to get an adrenal bracelet if there's still adrenal insufficiency. So just for people, like if any situation they are in emergency or EMS, to know that they have adrenal insufficiency, because in any stress situation they're going to need high dose steroids. So this is if they end up having adrenal insufficiency, but a lot of times the other adrenal gland just takes over, and sometimes they don't even need any hormonal replacement at all, hydrocortisone or fludrocortisone. As long as we can live with one adrenal gland, as long as this adrenal gland is totally functional, we can live with one adrenal gland and we don't have to feel a significant difference in our quality of life.